We have Travis Nelson, who is a union representative from the Washington Nurses Association, also sits on the Policy and PAC board for the Washington and Oregon Nurses Association, and is himself a nurse. So Travis, welcome to my kitchen to talk about what's cooking. He is going to share with us a perspective from the front lines on healthcare, and also share a recipe for a delicious peach drink.
Yeah, thanks for having me, Val. I'm really excited to be on this episode of your show, and I'm looking forward to having a discussion about what's happening with nurses and healthcare workers on the front lines.
Great. So what do you most want people to know? First of all, what are you seeing, representing nurses in Washington, where Seattle was the epicenter, and, in Washington, Oregon, we have both urban, high density, and rural, low density communities. What are you seeing, and what do you want people to know?
Yeah, so in Washington State, I do work with the Washington State Nurses Association as a labor rep. And then in Oregon, I'm very involved on the PAC board and the Oregon Nurses Association's Cabinet on Health Policy. And while we're seeing some similarities, we are seeing some differences as well. So for instance, Seattle got hit very hard with COVID initially. However, thanks to the actions of both Governor Inslee and Governor Brown, the Northwest wasn't hit nearly as hard as an area like Seattle. That said, nurses are going through a lot, especially the nurses and healthcare workers who are working, in the ERs, in the ICUs. PPE has been a very big issue. Not having enough of the PPE, not having enough masks, not having enough gowns, not having enough of the PAPRs and CAPRs, which are devices used to keep folks from being exposed to viruses when they are doing direct patient care. That's caused nurses a lot of stress and anxiety, as they don't want to get sick themselves, but they don't want to bring the virus home to their families as well. So the work that I've been doing has been related to pushing hospitals and healthcare organizations to do everything they can to keep their nurses and healthcare workers safe.
And what, from a patient perspective or from a citizen's perspective, what do you want people to know? I've heard everything from, I live in a rural community, we're fine, this is only an urban problem, or this is no worse than the flu. Why are we so worried? Why are we taking these kind of steps? What would you say to them?
Well, what I would tell them is urban areas, yes, are getting hit harder just because urban areas are denser. And we're seeing that initially. However, this is going to filter out everywhere. One of the things we're seeing with the WSNA, right, is that while the Seattle area got hit hard, rural Eastern Washington is now being hit. It's taken some time, but over in the Tri-Cities, there are meat packing plants, which is a rural area in southeastern Washington. I believe it's a Tyson plant, has had a lot of exposures. I think I saw something recently where they've got 100 cases over in rural Eastern Washington. And one of our concerns is with these rural areas is they don't have as many nurses and doctors, and they don't have the hospital bed capacity that some of our major metropolitan areas have. So it's really important for folks to know that this is not just an urban problem. This is a rural problem, and if you're not seeing it yet where you live, it's just a matter of time before you do see it.
Right, and is this like the ordinary flu? You've been through flu seasons as a nurse, and you've seen this. What's the difference?
Big difference. I was actually working at the bedside when the swine flu hit a few years ago, and I was doing critical care ER work, and nurses who I've worked with, nurses who I'm currently working with are saying this is nothing like the swine flu. It's much more intense, and it's got a bit of unpredictability about it, right? Like there are folks who are completely asymptomatic, who do not feel bad at all, yet they can give it to somebody, and that person can become deathly ill and end up on a ventilator or even die. And that's not something that we typically see with the flu. Also, once you contract COVID, I think there's something like a 10% or there's a dramatic increase as it relates to the likelihood that you will die from the coronavirus and COVID-19 compared to the flu. So it is not the flu. It should not be compared to the flu, as it's much more deadly. And we need to save lives, and we need to not spread misinformation when it comes to this virus.
So the bottom line is it's much more contagious, and it's much more fatal for those people, the higher fatality rate for people who get it. And so this is not like the flu. We need to take this seriously, and the steps that our governors have taken in Washington and Oregon have saved lives. What else would you want to tell people, in terms of how we're approaching this? There's social distancing, there's staying at home, there's washing your hands, wearing masks. What other provisions can they take to make sure that they're prepared?
Well, along with all those things that you mentioned, one of the things I want to talk about that nurses often mention to me is advance directives. Every single person should have an advance directive or a living will. What tears nurses up is when a patient is admitted, patient ends up in ICU, ends up on a ventilator, and the family needs to be brought in to consult with the doctor to say whether they want to take mom, dad, grandma, grandpa, or even a child in some cases off of a ventilator. And I think most of us would rather have our decisions that we've made for ourselves followed, rather than have our family put in a position to where they need to make those type of decisions for us in our final days. None of us likes to think about death, but it's very, very important that we all have an advance directive or living will, so that our families know what our wishes are when we are in our final days. And we don't need our families or nurses or doctors being put in a position to where that decision needs to be made for us. So get an advance directive or a living will. It's not as complicated as you think.
Right, that's fantastic. And in the meantime, while we are all sheltering in place and we're eating and we're drinking and we're, spending time with our close loved ones or alone, you have a recipe that you want to share that can make it a little bit easier. And what is that recipe?
Yeah, it's basically like a peachy berry margarita. And essentially what it is, it's a cup of your favorite berries. They can be frozen, they can be fresh, they can be dried. And the version that I made for you, I used dried raspberries from my garden. And then 2 cups of margarita mix, 4 shots of tequila, 2 shots of peach schnapps, ice as desired. And you can even add a half a cup or half a cup of energy drink or 5-hour energy to it if you need a little bit of pick-me-up, but neither the energy drink or the alcohol is required. It actually makes for a really wonderful virgin drink.
That sounds like it's incredibly refreshing, and I'm looking forward to when it's sunny out and I can try it. Well, thank you, and we'll show your recipe. And again, I so appreciate the work that you're doing. So many of us just want to say thank you to our healthcare providers that put their lives on the line to protect and serve our communities. So thanks for what you do, and thanks for taking the time to talk to me.
All right, thanks a lot, Val. And thanks for all that you're doing down in Salem to protect workers and protect those on the front lines. While I am a nurse and a healthcare professional and a healthcare provider, I want to make sure that we're recognizing all the grocery store workers, the bus drivers, all of those essential workers that are out there putting their lives on the line, being away from their families, so that we can continue to have the quality of life that we're accustomed to experiencing. So thank you, and thanks to all the workers out there doing their jobs.
Want to see more What's Cooking with Val? Make sure to subscribe to our page by clicking the link.